Hello, everyone. This is Yuanyu on traditional Chinese medicine. I am a fifth-generation TCM doctor, trained in a family tradition, and a graduate of Beijing Traditional Chinese Medicine University. Today, I'd like to start with an article I wrote in 2021 on Heart Yin Deficiency and add some details that weren't clearly explained at the time, particularly on pulse diagnosis and TCM theory. Let's begin. Previously, I briefly mentioned that patients with Heart Yin Deficiency often cannot be treated by directly tonifying Heart Yin. One must first clear the channels. Many friends on Facebook and fellow TCM practitioners ask me about this, so I'll explain using two real cases I've handled. Case 1. Patient A presented with most of the standard signs of Heart Yin Deficiency: palpitations, chest tightness, spontaneous cold sweats, night sweats, tidal fever, insomnia with vivid dreams, irritability, dizziness, poor memory, and a fine, rapid pulse, among others. The patient reported that previous TCM doctors had all prescribed Zhigan Qiaotang, but taking it actually worsened the palpitations, and the heart rate shot up to 180 beats per minute. On pulse examination, I found evidence of organic heart damage. Upon further questioning, the patient confirmed that Western doctors had diagnosed mitral valve damage. Why hadn't previous TCM doctors detected this? It's often because such patients present when the stringent pulse superimposed on the pathological pulse of Heart Yin Deficiency, namely, a slightly floating, wiry, fine, rapid pulse. Over time, as the organic damage persists, this astringent quality tends to sink deeper. It is usually both choppy and weak, so the physician must palpate carefully to detect it. For prescription, I still use Zhigan Qiaotang as the main framework to nourish Heart Yin, but I removed certain components and added herbs to open and unblock the heart vessels, such as Dan Shun Honghua or Taorun, any of which could be chosen. This successfully resolved the patient's palpitations. In fact, within 15 minutes of taking the medicine, the heart rate stabilized at 80, 90 beats per minute, and blood pressure dropped accordingly. This illustrates that with correct TCM pattern differentiation and treatment, results can be rapid. Case 2. Patient B, living in Shanghai, very sincerely invited me to fly from Taiwan to treat her. She had classic Heart Yin Deficiency symptoms, yet after seeing numerous doctors, had found no relief. On pulse examination, I detected that at the heart pulse position, the surface felt slightly slippery, but beneath it at the kidney position lay a rare and distinctive type of choppy pulse, different from the pure choppy pulse in the previous case. I asked whether she had suffered a major fright during adolescence. She recalled that in high school, she had unfortunately been sexually assaulted by a stranger, which led to a lengthy legal process that drained her emotionally. Although TCM commonly says great fear injures the kidney, in reality severe fright can damage all the zong and fu organs. For example, many soldiers in World War I with PTSD exhibited patterns of liver injury, with internal wind stirring. In the Huangdi Neijing Ling Shu, Chapter 8 Ben Shun, it states, "In fear, the spirit wanders in disarray and does not return." In TCM, the heart governs the shun, so fear can disturb the heart spirit. This is reflected in the pulse exactly as described here. Additionally, as a diagnostic aid, one can press the Xintang point, which will usually be tender in such cases. It's worth noting that in TCM, each of the 5 zong organs governs a distinct aspect of mental activity. Heart stores a Shan point. Xintang lung stores a Pa point. Pohu liver stores a Han point. Hunmen spleen stores the E point. Isha kidney stores a G point. Jisha, strictly speaking, the Neijing defines human mental activity as comprising Jing, Shen, Han, Pa, Xin, E, Ji, Si, Ji, and Lu. Each can be diseased by external or internal factors, producing complex psychophysiological patterns, something I'll discuss in more detail another time. Returning to patient B, I believe her early trauma had metaphorically injured a single drop of constant blood in her heart. Restoring that drop would cure the Heart Yin Deficiency that had persisted for over a decade. Most doctors would never uncover this in questioning, but the pulse revealed it. After 3 to 5 doses, she fully recovered, proving the validity of this line of reasoning. In both cases, the symptoms were textbook Heart Yin Deficiency, Yet a skilled pulse reader could detect subtle qualities that reveal hidden conditions not obvious from outward symptoms, allowing for greater diagnostic precision and targeted prescriptions. Conversely, those who lack pulse reading skills often rely on rote memorization of patterns from classics like the Shang Hanlun or Jingui Yaolu, and then force-fit formulas. If such treatment achieves even 20-30% effectiveness, it's already thanks to Buddha and God's blessing. This, in my view, is a key reason why so many practitioners fail to cure stubborn illnesses. That's all for today's discussion. If you enjoy my insights on TCM, please save and subscribe, and perhaps buy me a coffee to show your support. Thank you, and I'll see you in the next video.